Did you know he'll help you understand? Did you know always a right hand man? Did you know he's gonna make it clear? Did you know? Come on, listen here. Did you know?
Welcome to the Did You Know Show today. My name is Brian Green, and I am in the office of Dr. Stephen Blake. And we have been having some really good conversations. I'm going to read his bio because I don't want to mess it up and miss out anything. Dr. J. Stephen Blake was born in Columbus, Mississippi. He moved to Peoria, Illinois at the age of 3 and returned to Mississippi at the age of 6 to Clarksdale, where he resided until completing high school. He is a graduate of University of Mississippi with a bachelor's degree in chemistry and zoology. In 1980, Medical Technology School, in 1981, North Mississippi Medical Center, and completed medical school at the Philadelphia College of Osteopathic Medicine in 1989. He completed his residency in internal medicine at the Hospital of the PCOM in 92 and his fellowship in gastroenterology in 1994 at the Hospital of PCOM. He became board certified in internal medicine and gastroenterology. He's a graduate of the Osteopathic Heritage Health Policy Fellowship through Ohio University and New York Institute of Technology in 2001. He started Blake Gastroenterology Associates LLC in December of 96, which is established in 2005 Mount Airy Ambulatory Endoscopy Surgery Center, and in 2007 Mount Airy Anesthesiology Associates. He is a graduate of the Leadership Incorporated Philadelphia, a premier leadership development program class of 2004. He is the past member of the Board of Trustees and Alumni Board of Directors for the Philadelphia College of Osteopathic Medicine, and a past member of the Board of Trustees for the Boys Latin Charter, Philadelphia. He is a member of the University of Mississippi Alumni Board of Directors. He is also active in a number of organizations. Alpha Phi Alpha is one of them. My D9 brother. Shout out to the Alphas. National Osteopathic Medical Association, National Medical Association, American Osteopathic Association, Pennsylvania Osteopathic Association, Pennsylvania Gastroenterology Association, Philadelphia County and Philadelphia Medical Society, Mount Airy Business Association. Wow. Without further ado, and I've been talking here and just being uplifted in conversation, I hope you will as well. My pleasure to bring to my show Dr. Stephen Blake. Welcome to the show.
Thank you for having me. I'm looking forward to
A
conversation. Some good conversation.
Yes. I've read your bio, which I'm very impressed by the way. And I don't just say that. But who exactly is Dr. James Stephen Blake?
Well, I'm a Mississippi boy that came to Philadelphia to become a physician. And that was at, as you mentioned, the Philadelphia College of Osteopathic Medicine. And had opportunity to go other places, but my mind was made up. I wanted to become a DO at what at that time, and as far as I know, still one of the premier osteopathic medical schools in the country. And so that's how I got to Philadelphia. My intentions were to do family medicine and return to Mississippi and to practice family medicine in a small town. But when the opportunity presented itself for me to do a fellowship in gastroenterology, I seized the opportunity. I recognized the rarity of our African American community of having gastroenterologists, and so I felt that I couldn't pass up that opportunity. As a matter of fact, in the 125-year history of Philadelphia College of Osteopathic Medicine, I'm the first African American to do a fellowship in gastroenterology, and unless they reactivate the fellowship program, I'm the first African American and the last African American to do a fellowship in gastroenterology. That's just to give a perspective of the rarity and the challenges of that subspecialty. So as I mentioned, I'm from Mississippi originally. I had wonderful parents. They supported my decision to go to the University of Mississippi, which was a challenge and still somewhat of a challenge. And it was so challenging until the first semester I thought it would be best for me to leave.
Oh, wow.
Because there were so many of my classmates. There was about 50 of us came in wanted to become physicians.
Mm-hmm.
At the end of the day, only 2 in my class became physicians. Most transferred or unfortunately changed their majors or was dismissed from the university. But my parents would not let me leave. They supported me to go there, and when I was wanting to leave, they did not support me to do that. And I'm going to share this with you. When I called home to let my mom know, I think it would be best for you to come get me, she was so quiet on the phone until I thought she wasn't there. And so I finally asked, Mom, are you still there? And she said, I am. I said, so when are you coming? She said, I'm not coming at all because you're not going to leave. And you're going to work harder, you're going to study harder, you're going to graduate, and you're going to become a physician despite the challenges. Click.
Wow.
And I said, oh my God, what have I got myself into? I was 18, I could have left, but because of the respect that I have for my parents, they're both deceased now, unfortunately, I felt that if I had not stayed,
Mm-hmm.
it would have been an embarrassment for my parents, who were the only ones in my small town who supported my decision. And I knew that my parents wanted me to be there. And my mom and dad said if you had left, you would have been running for the rest of your life whenever situations became challenging. And so that first semester at Ole Miss, my mom, which was only 60 miles from the university, Clarksdale, she came over every Saturday morning with my baby sister to support and encourage me. She would take me out shopping, she would take me to lunch, she would buy groceries and what have you. But I needed that nurturing because I was raised on a small college campus in the Mississippi Delta. And as you mentioned, we were in Peoria, then returned to Mississippi. And the only reason we returned because my mom vetted the institution when my father was being recruited to come to that campus for the high school. My mom said, we're not going. She intercepted the letter because she was at home, and she made the decision we were not returning to Mississippi. And when she vetted the institution, a 2-year community college, a high school, and an elementary. And so, thus being an elementary, we wouldn't have to leave the safety of the campus. Those were difficult times.
I just started, come on with it.
In the mid-'60s. We moved back to Mississippi in '64, and that was when the 3 voter registration young people were murdered in Philadelphia, Mississippi. So that was, the summer '64 was one of the worst summers ever. And my mom was like, we're not going back. But after she vetted the institution and she saw it was a safe haven, 24/7 security, her kids didn't have to be out of her sight for the most part because we was on campus, and that's how we got back to Mississippi.
Were you the first generation college student in your family? Doesn't sound like it.
No, my father actually was the first in his family.
Okay.
He went to Mississippi Valley State University. At that time it was college. Mississippi Valley State College. That's where Jerry Rice, most people know Jerry Rice, that's where he graduated from. And so my father was the first African American to get a bachelor's degree in secondary education in the state of Mississippi with a focus on automobile mechanics.
Wow. What year was that? You got to tell me what year was that, because this is history we're talking about. Do you know off the top of your head?
I was born in '58.
Okay.
And so I think my father, when he went to college, he went on the GI Bill.
Okay.
So he had 2 children, my brother and my older sister.
Okay.
And when he entered college, and when he completed college, I was born when I was in college. So he must have graduated in '58
Okay.
or '59. I don't even really know. But so he left Mississippi in '61. And because of concerns of safety.
That's when you moved to Peoria, and then Peoria was a part of the northern migration.
Well, he went to Peoria. My grandparents were concerned about his life.
Okay.
Because when he came back from the Korean War, even before the Korean War, he wasn't into subjecting to Jim Crow.
Okay.
So when he came back from the war, after being a medic on the front line, he was nowhere near accepting it. And my grandparents and my mom was concerned about his life. There was a lot of lynching going on during that time. And so my grandparents convinced my father to leave. And so he went to Bradley University in Peoria, Illinois, to pursue a master's in guidance and counseling. But when that institution, Coahoma Junior College and Coahoma Agricultural High School, decided to establish an automobile mechanic program in the high school, who did they recruit? The first African-American man to get a bachelor's in Mississippi with a focus on automobile mechanics. So that's why they sent the recruitment letter. My mom would stay at home. She intercepted the letter. She made the decision, we're not going back. It's too dangerous. They just killed all those young people. But after she found there was a safe haven, and she knew my father never wanted to leave Mississippi. He wanted to be a part of the efforts to effect change. So she knew that's where his heart was. After vetting, she gave him the letter, and he did just what she expected him to do. We loaded up his big box truck, and we were off back to Mississippi.
Wow.
Again.
What exactly does the practice of gastroenterology entail?
Gastroenterology is probably one of the most important subspecialties of internal medicine. We have cardiology, rheumatology, pulmonology, endocrinology, nephrology, gastroenterology. The gastrointestinal system has places where a variety of different cancers can occur. And the more concerning one and the most prevalent one is the colon cancer.
Okay.
It's the number one preventable cancer. It is number two as far as deaths, longest number one. So, but every part of the body can develop cancer. But colon cancer is the only one that we can say with confidence that we can prevent by merely doing a colonoscopy, finding polyps, and removing them before they have a chance to progress to cancer. Beyond that, heartburns, reflux, indigestion, nausea and vomiting, gastric ulcers, duodenal ulcers, gallbladder disease, chronic pancreatitis, acute pancreatitis in people who drink excessively, pancreatic cancer, esophageal cancer. So many different things can happen in the gastrointestinal tract that puts it at the top. The majority of the people that go to the family doctor every day go in because they're having some type of gastrointestinal problems. The majority of the people that go to the ER every day, they're going in with some kind of gastrointestinal problem, abdominal pain, constipation, nausea and vomiting, diarrhea. So GI is a very, very important subspecialty. And to take it even further, obviously the brain is connected to every part of the body, but the part of the body that the brain is most intimately connected to is the GI tract, and specifically the colon. So much so we call the colon brain number 2.
Wow.
Because of the intimacy of that connection. You might have to beep this word out, but we all have heard the phrase, I was so scared until I shit myself.
Right.
That's because of this intimate connection.
Interesting. Between
the brain and the colon.
Wow.
Brain number 1 and brain number 2. So
I'm going to jump in really quick. What's that disease or that ailment when you can't eat nuts? Diverticulitis or something?
Well, diverticulosis.
Thank you for correcting me.
Diverticulosis. And the ending when it becomes itis means inflammation like arthritis.
Okay.
So diverticulitis develops in individuals who have diverticulosis. And when the diverticulum become inflamed and are infected, then the term is diverticulitis. Now, back in 2009, there was a major study with about 10,000 people with diverticulosis and without. And they found that the people, and they told them, all just eat as many nuts as you want to. Mm-hmm. And they found that there was no true correlation of eating nuts that would lead to diverticulitis or leading to bleeding diverticulosis. That's the number one concern. Diverticulosis has the propensity to bleed. And if that starts happening, you'll see blood just pouring from your rectum. Oh. You'll sit on the commode and you look back and you thought you had passed feces and just a commode full of blood. You need to go straight to the hospital. But we don't tell people not to eat nuts anymore if they have diverticulosis.
I learn something every day.
Yeah.
Let's take a quick break. We'll come back on the other side. Don't go away. I'm sitting here with Dr. Stephen Blake. We get ready to get uplifted. Don't go away.
Did you know?
Let me help you with that, Mr. Smith.
Oh, thank you.
How did this get here?
You got one too?
Yeah.
Ah, new recruits? I'm sure you're wondering why you're here. This is our Elite Caregiver Super Training Center, and you two are the perfect candidates.
This is incredible.
I know, right? Ready to become an Always Best Care caregiver? Working for the best team with competitive pay? Join Team Green.
Always Best Care supports diversity. There's a hero in all of us.
Dad, you can't do this anymore. I think it's time to consider a nursing home.
But I don't want to leave my home, all my stuff.
But Dad.
Alva.
Always Best Care is here to help.
With Always Best Care, we come to you and do anything you need to continue living at home with our care.
You really are a hero.
Let Always Best Care take care of your loved one. Everyone deserves the best care, always.
Did you know? Come on, listen here. Did you know?
Welcome back to the Did You Know Show. I just want to remind everybody, my show is sponsored by Always Best Care Senior Services. We provide in-home care primarily to seniors, but if you're somebody that has had a hip, a knee replacement, a back injury, if you're recovering from a stroke or battling cancer, if you're recovering from COVID, please think about Always Best Care first. We are the agency that never sleeps. You can check us out at teamgreenabc.com. And guess what? We're hiring. If you're looking to join a rewarding career and a stellar team, we offer competitive medical, dental, vision, 401k, and as of late, I'm offering free SEPTA key cards for those employees that qualify. All right, as we rejoin our conversation with Dr. Stephen Blake, I want to ask you, Dr. Blake, why did you step away from the insurance companies?
It was a very tough decision to do so.
And courageous.
Well, some people have said that as well. It was no precedent to a specialist as a gastroenterologist doing what I did. But the pandemic contributed to the decision to do it. I felt like I had no other option that was viable to ensure that I could still stay in the community. Even though we couldn't work and take care of patients, bills continued to accumulate. And several years before the pandemic, the insurance companies began just slashing and cutting your reimbursements for submitting claims. And so as a solo gastroenterologist, I was averaging anywhere from 50, 60, or 70 procedures a week, trying to do enough volume to generate enough revenue to take care of 20 employees and all the overhead expenses and what have you. I equate it to the experiences being an insurance provider to sharecropping of the South, where the sharecropper worked all year to raise the cotton, bought supplies from the plantation owner, from his store and what have you, and then at the end of the year, with the harvest, the sharecropper expected some level of profit, but every year he was told, well, you didn't break even this year, you're still in the hole. Maybe next year you'll do better. So year after year after year, they never got out of the hole. Similar to physicians. You are putting all the money up front, you're taking all the risks and all the responsibilities, and you are taking care of patients, and then you submit claims for payment. You might get paid, you might not get paid. And if you get paid, it was after months of fighting to get paid. And if they felt that in retrospect, when they reviewed what they paid you, if they found something, whatever, a T not crossed or I not dotted, they could take money back from you.
Yes.
So now, here you are, you working, but you're not getting paid because everything you're doing, they're taking back from you. So it was just a no-win. So after the pandemic allowed us to come back to provide services, it was obvious that if I went back doing the exact same thing that I did before the pandemic, why would I think that I would ever get out of debt? Why would I think that I would ever be able to give my employees pay raises? Why would I ever think that I'll be able to afford the increase of malpractice costs for insurance? So I prayed about it. I said, God, I have two choices. I can go back to that dysfunction, or I can step out on faith and create some kind of way to be in the community without being a provider accepting insurance. I couldn't figure it out. And so I was just going to do cosmetic type things, which I do, smart lipo laser, liposuction, body imaging, enhancing, has nothing at all to do with weight loss. It just improve how you look in your clothes.
Okay.
Smart lipo laser. And plus I do hydro cleansing. Some people use the term colonics, but back in 2013, that summer was horrendous with the amount of colon cancer I was diagnosing in people well above 50 in their 60s and 70s. And when I asked them, why would you wait to come in for your first colonoscopy at 65? Every one of them said, I had been in before, but I could never get clean with drinking that prep. And so I just never went back. I said, well, you got the prep down for this procedure today because something was wrong. I had to make sure I was okay. And I told them all, well, you're not okay. You have cancer.
Wow.
And so it's not easy to have to set a person down and talk about a cancer
I can only
that
imagine.
you know didn't have to be if they'd only had a colonoscopy timely. At that point, back in 2013, I was like, I'm burnt out with this colon cancer. Just too many people that's dying unnecessarily. So again, I prayed for some type of creativity to address that issue with drinking the prep. And the answer was to do high enemas, the colonics, that I knew people enjoyed having. And I wasn't knowledgeable about the quality of the cleanse with the colonic. So for 6 months, I did it without pay because I wanted to perfect it and have it reproducible.
Okay.
And so after I was able to perfect it, it became the most requested method to be prepped for a colonoscopy as opposed to drinking the prep. And so when I decided to stop taking insurance, I was going to have smart lipo laser, liposuction, my colon hydro cleanse services, my intravenous IV hydration services, and also counseling people about weight loss, eating properly, and helping people who have irritable bowel syndrome, which is some components of worrying too much and anxiety and what have you. But the community kept pushing back, saying, look, Doc, we need you back doing GI.
Okay.
So I attempted to return doing just flexible sigmoidoscopies, where you don't need to be sedated and you just look at the left side of the colon, and complement that with the Cologuard test, the DNA, fecal DNA test. You might have seen the little white square box on the commercials, the little skinny blue legs. So I was going to do the FlexSig and the Cologuard test. But I realized if either one of those had polyps or were positive for the possibility of having cancer with the Cologuard test, it would have been impossible for me to get somebody in for a colonoscopy expeditiously.
Okay.
They would be stressed out waiting months. So I decided I couldn't do that anymore. I couldn't do the Cologuard and the FlexSig. But on the last FlexSig, the person was a little anxious. I had my staff to bring in the nitrous oxide gas. I had cleaned the person out with the hydro cleanse, so the entire colon was clean anyway. So I gave them the gas. I had completed an entire colonoscopy before I knew it. It was like old times, without giving them, quote unquote, the Michael Jackson drug, propofol.
Okay.
So, which is nowhere near as safe as people equate it to be after they have such a wonderful sleep from it. It's not that easy. But anyway, so when I realized that I could keep a person comfortable with nitrous oxide gas, which is no concern about their heart, no concern about their lungs, no concern about their kidneys, no concern about their muscles, all those are concerns with propofol.
Okay.
So nitrous oxide gas, I use the acronym SEE, S-E-E. S is safer, because there's no concern about the heart, the lungs, or the kidneys, or what have you.
Okay.
Because they are awake comfortably. In the first E is it's easier. The majority of the time when a gastroenterologist perform a colonoscopy, they need that person to go from being on their left side to their back, and then from their back on their left side. Now, when you are asleep with propofol, guess who have to flip you back and forth?
The nurse. I don't know.
The gastroenterologist.
Okay.
And based on how heavy the person is, the gastroenterologist, especially if it's a young female gastroenterologist, have to enlist help from the nurse and anybody else they can get, especially the person 300, 400 pounds.
Okay.
So,
actually, I wasn't so off. Okay.
You know, so I've had to have 4 people in the room to flip people sometime.
Okay. Wow.
So with nitrous oxide gas, I say, Mr. Jones, I need you to turn up on your back. Okay, Mr. Jones, now turn back on your side. It's easier. And the second E is for educational. If I find an abnormality that I can point on the monitor for the person to see it, now they have seen what I see. And after I finish the procedure, it's much easier for me to explain to that individual what I showed them on the monitor, as opposed to if they were asleep, then trying to be creative in my language on a level that they can understand without having seen what I'm explaining to them. A picture's worth 1,000 words.
You know, I don't know if you all are getting the vibe that he's just so straightforward. He really should be a professor. But a lot of times when you go to a physician, be it a specialist or your primary care physician, sometimes I find them to manage the disease or the ailment as opposed to the person. Your approach is what? Because I could talk to you. You don't seem like you're rushing people in and out.
Well, I don't. I lecture for 22 years to second-year medical students at Philadelphia College of Osteopathic Medicine in gastroenterology.
Okay.
And
I can see that.
And I allow students to rotate with me for 2 weeks or 4 weeks up until the pandemic. So I'm just a teacher. And so I teach my patients, because if I can educate the patient to understand more clearly what they need to stop doing that's detrimental, and educate them on what they need to start doing that contributes to longevity and well-being, I've decreased the battle of helping keep you alive. Before we go to break, we're going to take a quick break. We'll take a quick break in here. What are your office hours? We're open Monday through Friday from 8 a.m. to 4 p.m. There are special Saturday hours. You have to call in and request that. It is a little bit more costly because I have to open up and come in. Okay. But we are here Monday through Friday from 8 to 4. And we happily recognize ourselves as being urgent care gastroenterology. As opposed to waiting months to get in, we get you in several days. Wow. If you look at the bottom of your screen, you'll see Dr. Blake's information. This is an old school doc. Listen, we're going to take a quick break. We're going to come back on the other side and continue our conversation with Dr. Stephen Blake. Please don't go away.
Did you know?
Dad, you can't do this anymore. I think it's time to consider a nursing home.
But I don't want to leave my home. All my stuff.
But Dad.
Albert.
Always Best Care is here to help.
With Always Best Care, we come to you and do anything you need to continue living at home with our care.
You really are a hero.
Let Always Best Care take care of your loved one. Everyone deserves the best care. Always.
Let me help you with that, Mrs. Jackson.
Oh, thank you, dear.
How'd this get here? You got one too?
Yeah.
Ah, new recruits? I'm sure you're wondering why you're here. This is our Elite Caregiver Super Training Center, and you two are the perfect candidates.
This is incredible.
I know, right? Ready to become an Always Best Care caregiver? Working for the best team with competitive pay? Join Team Green.
Always Best Care supports diversity. There's a hero in all of us.
Did you know? Come on, listen here. Did you know?
Welcome back to the Did You Know Show. We're going to continue our conversation with very, very empathetic Dr. Stephen Blake. Off the screen, I've been telling him all of my ailments, but I have just decided to enlist him as one of my docs. That being said, Dr. Blake, what do you envision for the future of medicine, and specifically for the African American physician?
That's a very deep question. And I'm going to share what I recognize 10 years prior to going to the pandemic of 2020. In 2010, after the Affordable Care Act was passed in February of 2020, the onslaught of efforts to eliminate it, and with the Achilles heel requiring electronic medical records, I recognized that medicine was about to change and it would never be the same again. And that unless I could figure out how to remove myself from that system that had been modified and was developing, that I would not be in practice. So what I see now is that healthcare is faced with a major revolution of what it's going to eventually be about, because the way it is now, it's going to implode. Mm-hmm. It can't survive much longer as it is. It's going to just implode. And so, and at the center of that implosion is the insurance companies. They're going to have to change to where they are. Now I'm going to be very just frank with you. In the 50s and the 60s, the number one entrepreneur in the African American community were physicians. Mm-hmm. There was not, most people had no insurance, and the technology of the services and procedures that are available now were nowhere near present in the 50s and 60s. And so those African American physicians' livelihood was directly dependent upon their patients from the community coming to them, paying them their $5, $10, or $15, whatever the case might be. Once the insurance companies established themselves, because in the 50s and 60s, if there was any doctors involved with the effort to bring about equality and eliminate injustice, they were the few, if not the only ones, that could not be told, if you're out there, you won't have a job on Monday morning.
Oh, wow.
They were independent.
Right.
So my belief is that the insurance companies effectively eliminated those independent African American physicians. Practically every physician, regardless of their race or gender now, works for a healthcare system.
That's true.
So by that being eroded, unless changes occur, we'll never see independent physicians of any significance again. And that's why I made the decision that I had to figure out some kind of way to stay independent and to remove myself from the insurance companies. Otherwise, I would have lost all the things that my parents made unbelievable sacrifices in order for me to sit here and have this conversation with you as a gastroenterologist. So I believe what I'm doing is contributing to the revolution, if you will, to be an example to young doctors to believe that they can have enough support from the community to pay them a few dollars, okay, so that they can be independent. I call, my position is that, and I'm not going to name the system, but I called to try to have a conversation with that office because I needed a referral. I stayed on the line 39 minutes. They answered and put me on hold and never came back.
Wow. Well,
There's no way in the world I would ever do that to a patient. But because of the system the way it is, it's overwhelmed. People have 2 minutes with their doctor. They can't get an appointment for weeks when they need to be seen. It's no quality.
what is the holistic colonoscopy and EGD?
Holistic, as an osteopathic physician,
Right.
the philosophy of an osteopathic physician is holistic medicine.
Right.
When you walk into a osteopathic physician's office, a DO, it's not about where's the pain, let me write a prescription for you and let you go. Holistic medicine is to interact with the person to encompass mind, body, and spirit. Everything that you do about your body is based on what's occurring up here. So, and as I mentioned earlier, the colon is considered brain number 2. So a significant amount of issues that's occurring in your gastrointestinal tract, the problem is not directly here. The problem is here. So if I don't have a conversation with you to find out what's going on in your world, I'll never know what's happening here that's contributing to the problems that you're having physically.
Wow.
So that's what holistic medicine is.
Okay. And what are the current concerns about colon cancer in regards to screenings? When do you start screening, and what should we know about young people and colon cancer?
You know, I want people to be aware that it's nothing magical. Now the recommendations are that men and women, regardless of race or gender, ethnicity or whatever, everybody should start at 45.
Oh.
We do know there are plenty of people who have died much earlier than 45. Probably the most recognized, or the most infamous death from colon cancer is Chadwick Boseman, the Black Panther star.
Yes.
He was 43. Prior to that, Katie Couric's husband, back in 1983 or 84, when he died from colon cancer at the age of 43. The youngest that I'm aware of someone dying from colon cancer is 18. So I want people to know, don't find solace and confidence, well, I haven't reached 45, I haven't reached 50, so I don't have to be concerned about colon cancer. No. The fastest rising age category for the incidence of colon cancer in young millennials, 18 to 35 or 37, 38.
Wow.
Now, there's no recommendations that those young people should come in. So those young people have to be educated and be knowledgeable about signs and symptoms. Rectal bleeding, black bowel movements, diarrhea, constipation are alternating between those two. Unexplained abdominal pain, unexplained weight loss. If you have any of those challenges, don't let a family doctor or family member say, oh, you're too young, don't worry about it. No. Don't worry about it, but just come in and get checked out to make sure you're okay, as opposed to waiting too late. I'm going to give you one quick story, then I'm going to talk about recommendations in more depth. A young 31-year-old African-American male just finished his master's at Stanford University, married, and his wife is 6 months pregnant. He had gone to his family doctor for a year or more about his rectal bleeding. He was told it was only hemorrhoids. When he got married, his wife is 6 months. She said, when are these hemorrhoids going to stop bleeding? I think you should go back to your doctor and make sure there's nothing but hemorrhoids. He goes back to family doctor, well, let's get you out for a colonoscopy. He was dead 6 weeks later. Stage 4 cancer all over his body.
Wow.
Wife is 6 months pregnant.
Wow.
Those are the things that I want to ensure that people understand. It can happen to you. It can happen to your daughter. It can happen to your son.
Wow. While we got a little bit more time, I want to ask you, is there any gastroenterology, GI reason we should be concerned about obesity and diabetes?
Yes. And let me go back to colon cancer just to share one other thing.
Okay.
If you have a family history, like Chadwick Boseman, 43, he didn't just wake up at 43 and die from colon cancer. There were polyps that had started growing well before he got to 43 in order for them to evolve into colon cancer.
Okay.
His children should probably start getting screened around 25, 10 years before the age of 35.
Okay.
To make sure that they're okay as best as you can. but also be aware of signs and symptoms as well. But a family history of colon cancer, you want to start 10 years prior to the recommended age of 45.
Okay.
Or 10 years prior to whatever age that individual probably just started having, developing colon cancer. So that would be about 25. You probably had polyps growing around 35, even earlier. We don't know. We don't know his story.
Wow.
I can tell my story about my challenge with colon cancer, but we'll never know his story.
Right.
So that's why I think it's so important for me to tell my personal story, how I was going in every 3 years because of my family history. My father, I started at 43, at 60, well, diagnosed December of 21.
Okay.
So I was 63, had just had a colonoscopy a year and a half prior to that. So when I started having problems, the last thing I was concerned about or gave thought to was colon cancer because of my due diligence. But I just want people to know, don't think age is a guarantee that you can't develop colon cancer. Now, getting back to obesity. Obesity increases the potential for every cancer of the body: breast, lung, colon, pancreatic, liver, especially liver and colon.
Okay.
So, and just to mention, obesity increases the potential of having issues with high blood pressure, increases the potential of having problems with diabetes. I had a young lady who I did a liposuction. Her abdomen was out to here. She was on oxygen. Once I did the liposuction, remove all the fat, she was able to breathe without oxygen. All that fat was having problems with her lungs expanding to breathe. So obesity can cause problems inside and out. So, we have I say it's an epidemic of obesity in this country, not the world, but in America, because of the access to, a lot of fast food, availability, not understanding proper eating habits, and what have you. And so that's why young children, puberty is developing earlier because of their obesity. They're developing diabetes earlier, type 2. There were times children didn't have type 2 diabetes, they had type 1. But obesity contributes to developing type 2. And you can develop type 2 without being obese, but it's a major contributor. So my thing is, I want to educate people on how to eat more properly.
Wow.
And I tell people, you don't eat to be full. You don't eat to stuff yourself. You just eat to satisfy. And if you eat to satisfy, well, then obesity won't be an issue for you. But we believe in eating until we can barely stand up. We go to buffets and we eat until we can't walk. It's just too much in front of our faces that it makes it challenging not to be obese. But you don't have to be obese.
Wow, you're singing my swan song. As we wind down the show, Dr. Blake, so many questions I have, but what do you and other African American physicians need from the community? How can we support you? How can the village support?
We need your support. As I mentioned, I do not accept insurances anymore. There was a major pushback when I made it clear to the community that I no longer accept insurances. And they gladly told me, well, I have insurance. I can go any place I want to go. I said, that's true. That's true. I said, but even before I stopped accepting insurances, you could have gone any place you wanted to go at that time. But you came to me. And the reason you came to me was because of a number of reasons. My patient population, which is 30,000 patients in my electromedical record system, 30,000, that's a large Mississippi town. That's a small city. Even in Pennsylvania, that's a lot of people for some small towns.
Right.
So I had 30,000 people. And so they said, look, I can go someplace else. I said, you either came to me, and my population is diverse, you either came to me because of the color of my skin, or you heard about my reputation and the quality of services that I rendered. Or some of you guys came to me because I'm a man. Some of you came to me because I'm the women came to me because I'm a whatever reason. So nothing has changed except for the fact I don't accept any insurances. But I was told by God, I don't need 30,000 people. I need 1,000 people. I want to demonstrate that a physician can survive without having to accept insurances. I want young doctors to believe that when they finish all their training, I saw what Blake did. I think I can do the same thing. Let me market myself to the community. So I'm educating the community to try to get them ready. There's some young doctors coming behind me that's going to want to be paid whatever.
Wow.
In order for them to be able to be independent in the community, and you don't have to be put on hold for hours on the phone or told it's going to take weeks or months to get you in. You can call them up. People call my office, and I said, look, okay, you can pop in this afternoon, or I can get you in tomorrow. Definitely can get you in next week, but not telling people I can't get you in for 8 or 12 months.
It's unreasonable.
That's an atrocity.
And we accept it. We we don't know any better. We accept it because you feel like you have to with these major health systems. It's, you're kind of at the mercy of them, and
You are.
And you shared an experience earlier about being put on hold with these voice response systems. You're lucky if you get a human being on the phone. Oftentimes you get a voice response system, and you have to push buttons. After I was hospitalized, I was hospitalized with a diabetic incident maybe about going on 3 years ago.
Okay.
Yeah, I have to just say it like that. But every day that I lie in the hospital, it was, a team of physicians with the attending physician coming in because of the teaching system, which I was fine with.
Mm-hmm.
And every day I would ask the doc, is it today that they're being discharged? And she's like, Mr. Green, you're really sick. I don't know if you know it or not. But at the end of that season, if you will, when I was discharged, that was the most overwhelming experience I think I've had in my life because, one, I was put on a number of medicines that I had no idea what the side effects was going to be, the dosages and so forth. Lucky for me, I run a whole home health system. I called the head nurse over. I had a complete meltdown. What I heard the doctor say and what I was focused on in the mind was, you're being discharged. So discharge is like, I'm going home, and my life was going to be returning as it was as I remembered it. That was not the case. I was then put on insulin, which I had never had any experience with injecting myself with any insulin. The dosages were wrong. I was discharged during the first shift. So second shift was there when we got home, and then, of course, now I'm in my 50s. And so, I can only imagine for my seniors, shout out to my seniors that go through this, that you feel sometimes often dismissed or, undervalued because, I'm thinking to myself, I know she said 40 cc's, but this says 25. And, I had access to a nurse because I run a healthcare business, but those people that are seniors that don't have an advocate.
Everybody's not as fortunate.
And I saw it very differently. Go ahead, Doc, I'm sorry.
And you mentioned the right word, an advocate.
Yes.
And so I see myself as an advocate. And my father told me when I became a physician, he said, son, whoever God sets in front of you, you do the best you can to educate that individual, as opposed to driving yourself crazy about everybody else. But if you educate that individual, then that individual is empowered to educate others. And so, an opportunity that you have given me to have this kind of conversation is going to help a lot of people because they've been educated about a lot of things. So I think what you're doing is amazing.
Likewise, I am so glad to have had the opportunity, and I know we're winding down the show, so we're going to take a quick break. We're going to take a quick break, and we're going to come back and wrap up the show. I hope you have been uplifted to this point as I have been. But don't go away. We're going to finish our conversation with Dr. Stephen Blake, who is in the Germantown, Mount Airy section of Philadelphia. If you look at the bottom of your screen, you can see his phone number. Your office hours are
Monday through Friday, 8 a.m. to 4 p.m.
Okay.
And as you mentioned, we're at 6827 Germantown Avenue. Phone number is 215-849-4902.
Hold on. Don't go away. We're going to continue our conversation and wrap up the show. Please don't go away.
Did you know
help you with that, Mr. Smith.
Oh, thank you.
How did this get here?
You got one too?
Yeah.
Ah, new recruits? I'm sure you're wondering why you're here. This is our Elite Caregiver Super Training Center, and you two are the perfect candidates.
This is incredible.
I know, right? Ready to become an Always Best Care caregiver? Working for the best team with competitive pay? Join Team Green.
Always Best Care supports diversity. There's a hero in all of us.
Dad, you can't do this anymore. I think it's time to consider a nursing home.
But I don't want to leave my home. All my stuff.
But Dad,
Alva.
Always Best Care is here to help.
With Always Best Care, we come to you and do anything you need to continue living at home with our care.
You really are a hero.
Let Always Best Care take care of your loved one. Everyone deserves the best care, always.
Did you know? Come on, listen here. Did you know?
Welcome back to the Did You Know Show. I'm sitting here with the incredible Dr. Stephen Blake, and he has just been giving us so many different nuggets of knowledge and wisdom. And I feel like I'm in a consultation, and you've talked to me in an easy to understand language. It wasn't above my head. I followed what you were saying.
Good.
From a business perspective, from the longevity of insurance, because I deal with it with my business. But, you know, during our conversations, you started out and you said, and I might have cut you off, but I want to kind of wrap the show down to this. When you said the study of osteopathic medicine, you know, what is it, one, and then do you collaborate with other physicians, and do you think, what is the reason that you think a lot of physicians are not going to come back into private practice?
Okay. Well, there are two disciplines of the practice of medicine as far as physicians are concerned. There's osteopathic philosophy. We are the DOs.
Right.
And then there's allopathic philosophy, and those are the MDs. And allo in itself means with assistance of medication.
Okay.
And then osteo is a prefix indicating bone, the skeletal system. So we wouldn't walk and be erect, and we wouldn't have blood being produced and what have you without the skeletal system.
Okay.
And so it's a vital part of who we are and who mammals are and what have you. So, but an osteopathic philosophical approach to the practice of medicine is holistic, meaning mind, body, and spirit. I'm not saying that there aren't allopathic physicians who don't believe in holistic medicine, but their institutional training is not of holistic medicine. In osteopathic medical school, the institutional training is to help you develop the philosophy of holistic medicine, mind, body, and spirit. So you're not going to go to a DO and not be engaged with conversation and questions in order for us to determine what's happening to this individual when they're not sitting here. What's happening at work, what's happening at home, what are the things that they deal with mentally and emotionally. The mind is so important because there's nothing in life that doesn't entail the use of your mind.
Mm-hmm.
Nothing. You know, so we want to know what's going on with your mind, and then that can give us insight to what is occurring with your body physically. And when we look at mind, body, and spirit, if I can determine where you are spiritually and emotionally, that can help me determine why some of the symptoms that you're having. And it's not always some kind of disease. People don't understand the power of the mind as far as affecting the body negatively. People don't understand the power of their spiritual being or their emotional state, how it's affecting their body physically. As a DO, I want you to understand, and especially as a gastroenterologist, I want you to understand how your mind impacts your gastrointestinal tract every moment of the day. So that's what an osteopathic physician is about as far as holistic medicine. But there are a number of allopathic physicians who have recognized the benefit. And you probably have heard more now about holistic medicine than ever before.
Very true.
And so, because it wasn't always accepted by my allopathic sisters and brothers of being anything of significance. But now they recognize that. You also hear about preventive medicine. That's an osteopathic philosophy. So now preventive medicine has become mainstream. It's because of osteopathic physicians. Holistic medicine is because of the philosophy of osteopathic physicians. Preventive medicine is because of osteopathic physicians, and they're both a mainstream now.
So doctors are, a lot of docs are under or collaborate with the major health systems. This is.
Can I add something before we finish?
Sure, go ahead.
You know, one of my missions, and I feel my purpose now, is to be an example for all physicians, young, mature, older, male, female, black, white. It doesn't make a difference. I want to be an example to physicians to believe that the community want us to be independent. They don't want us to be part of a system that they can't reach us when they want to reach us. If you have an issue, you don't want to be told we can get you in 6 months.
That's the truth.
If you are calling, you want to know, can I come in tomorrow? At the latest next week, but not 6 weeks, 8 weeks, 12 weeks. You don't want to be told, go to the emergency room. You want to see your doctor.
Yep.
I want to be an example to as many physicians as I possibly can to believe that you can survive. I'm struggling. I haven't got there yet. But my faith is strong that enough people are going to return to me so that I can stay in this community as long as I'm able to stand and push a colonic scope and do other things that I'm doing now. That's my belief.
That's important. All right, I'm given the sign by my producer that we need to wrap up. It's been my absolute pleasure.
I appreciate you inviting me on, and I hope the things that has been shared between the two of us is going to be a benefit to thousands, if not millions.
I can't see why I wouldn't. I've been uplifted, and thank you for breaking it down into easy to understand language. I've been uplifted. I've got so many different things to do. I got to work on myself too by example. Okay, the show has been brought to you by Always Best Care Senior Services. I want to remind my listeners that you can check me out on 4 p.m. on Saturdays on WURDradio.com. Or you can listen, on Saturdays. Saturdays, we broadcast this show at 7 a.m. Set your DVRs. We're having a great time at the Did You Know Show. The Did You Know Show is brought to you by Always Best Care. And the purpose of my show is to, again, the center and focus of it is to connect people to home, community, and business resources that you ordinarily would not know about. Dr. Blake, thank you for sharing your story, your knowledge, and your wisdom. Okay, I'll see you next time. Take care. Thank you.
Did you know he'll help you understand? Did you know always a right-hand man? Did you know he's gonna make it clear?